Hello, my name is Dr. Paul Wand, and I'm a neurologist. And today I'd like to tell you about my practice, which is actually called Integrative Neurology. Many of you probably have not heard the term of integrative, but it simply applies the combination of traditional medicine slash neurology to alternative medicine. Some physicians practice one or the other, and I choose to practice both because I think the benefits to patients is superior when combining the best of the traditional, also known as allopathic medicine, with the best of the alternative, sometimes called naturopathic. The naturopathic is a more open type of medicine. It believes in using a combination of supplements, vitamins, and sometimes even devices. As a result, the clinical benefits are superior compared to just the traditional treatment alone. There is scientific proof in many instances that the vitamins or supplements are safe and effective. The alternative method is also more open to accepting new modalities of treatment as opposed to traditional, which oftentimes takes many, many years, and people suffer and even die while the methods are being evaluated and tested, etc., etc. The last point I'd like to make is we have a major problem in this country, which is the spiraling increase of cost of medical care. And I believe, it is my opinion, that the only hope to stop that and correct that is to emphasize the preventative approach to medicine, which is the hallmark finding of alternative and integrative treatment. As an example of this success, I can give you the specific example of a treatment that I instituted 1 year ago, which is for diabetic neuropathy, although it can be applied to other types of neuropathy from other causes. Now I'd like to give you an example of the power of the integrative treatment of the case of diabetic neuropathy. Now, some of these patients have horrible pain for which they may be prescribed various medications, which may work and typically have significant side effects. I want to point out and emphasize that in traditional medical treatment, there's absolutely no treatment that addresses what goes wrong in those nerves to correct them. However, the complete opposite is true for this alternative integrative treatment, which I'm going to describe in the next section. This new and innovative and safe treatment consists of injections around the nerves in the feet, what we call perineural injections, and it meaning the injection has a cocktail of numerous vitamins, supplements, and antioxidants. In fact, there's about 15 different ones. Very small needles are used, and the skin is frozen beforehand, so most patients don't even feel the needle used to administer the injection. Once the injection site is complete, electrical pads are put on top of the area, and then there's an electrical stimulation for about 15 minutes, which causes the local absorption of all the ingredients. Then what happens is the peripheral nerve endings absorb all these nutrients, and the nerves begin to regenerate. The patients report to me on a regular basis that all their symptoms get better. Many patients report pain in the feet, and after even the first treatment, which contains also a local anesthetic, they report reduction of pain and even sometimes no pain at all. The injection is tolerated very well. So far, there hasn't been any serious side effects. So if you or anybody you know is suffering from pain and the medications that you may have been prescribed don't work or give you terrible side effects, You can learn more information about my treatment and even make an appointment by looking at my website, which is called southfloridaneurology.com. All my information is there. The office number is 954-344-9772, and the office is located in South Florida in the city of Coral Springs. Thank you.